Pepsodent Charcoal and Pepsodent Herbal.
EcoBank. Nero Prime Water.
Tonight, a surge in heart failure cases in Ghana alarms health experts.
Seven settlements cut off by a river impacting lives adversely.
Also in the bulletin tonight, Media General set to launch Ghana Month on Monday, March 2, 2026.
On the international front tonight, new strikes reported in Iran as Tehran hits U.S. bases and allies across Middle East.
Welcome to the program. We're live also on all our social media platforms at TV3 Ghana. Join us there. Let's get interactive and start the bulletin from here. Residents of 7 settler communities in the Central Tone District of the Volta region, they are enduring difficult moments assessing neighboring communities after being cut off by the river. Stanley Blewu reports that the situation is crippling local businesses and making life uneasy for residents.
It's a busy scene at the bank of the Mlagwe River. This is a major access route to Mafidove. For years, residents of Aflukope, Aklaya, Zikponu, Pogaji, Intapo, Kukudo, Peji, Hove and Dove have struggled to access one another as Mafidove remains cut off from its neighboring communities. Daily commuting is fraught with fear. In the absence of a footbridge over the Mlagwe River, residents have improvised mobility by relying on canoes. However, the rainy season brings an added layer of danger as the river overflows its banks and weeds cover the water surface. Accidents here periodically claim precious lives.
We normally use the river to transport ourselves to the next village. But you see, our this thing is boat. We don't have a machine on it. When you are coming at even late hours, you have to wait. If there is nobody here, you pull the rope yourself. If unfortunately and then it got stuck in the weeds, you can't even remove it. And because of this weeds, I lost my own brother. We approached the government that he should find some ways to solve this issue for us. But see, for so many years, we still transport ourselves using the boat.
Canoes here are self-operated. No paddles, no life jackets. It's simply a dangerous voyage. Residents seeking access to other communities depend on a rope tied to both ends of the river. A dedicated person pulls the rope to guide and direct the canoe. It's a short but frightening journey. Economic activities of the area also depend on this route, but not all traders find it easy navigating the stretch. This apple seller bears it all. Community leaders say they are worried about the decades-old problem, lamenting that successive governments have ignored their plight. Mama Aflu Viade II, Queen of Aflukope, speaks on the matter.
And when such things happen, it becomes difficult to have our children crossing, the school children. Sometimes the boat capsize. If it hadn't been for intervention of our men, we would have lost quite a good number of them. We are appealing to whoever cares to come to our aid so that we have a bridge over this short but troubling situation.
Opinion leaders say delays often occur, especially when traffic builds up at the riverbank.
Sometimes the canoe will be here. If there's nobody here crossing the river to the other side, then you're going to stay there for a very long time. So I would say in everything, economically, everything, it has impacted our life negatively here.
In all of this, pupils and expectant mothers seeking antenatal services are among the hardest hit. The assemblyman for the Dover electoral area, Moses Kwesi Ewukuvi Danyivo, serves as liaison between the communities and the district assembly.
Since I became the presiding member, we have had 2 regional coordinating meetings and have raised these issues. It is part of our minute. Our MP, the current MP, the current DC, even just yesterday, the DC and the MP, they were all here. They have to cross this same creek to access the place. So they are aware. I can't say the DC and the MP, they are also doing their part. But it is incumbent on the central government to actually listen to our MP, our DC, and the presiding member, and the entire citizens of the area.
Beyond transportation, the Mlagwe River also serves domestic purposes. Here, residents fetch polluted water for household chores when pipe-borne water fails to flow regularly.
In our town, mostly we short water. The tap doesn't flow. It can stop flowing like 2 or 3 months. So we use this water for cooking. But unfortunately, because we are using it as a transport to cross to the next town, sometimes it gets dirty. And at the end of it, our people get diseases, which we can't even know where they are coming from.
Traditional rulers warn that failure to construct a bridge over the Mlagwe River may compel them to take action in the best interest of their people. As residents of Aflokope endure difficulties in accessing adjoining communities, they hope government will address their concerns under the Big Push agenda to prevent further loss of lives in the pursuit of basic connectivity. Stanley Niblew, TV3 News, Mafi Aflokope, Volta Region.
Well, let's do some health stories now, beginning with the First Lady Lordina Mahama. She says the lack of hospital beds and critical health infrastructure continues to cost Ghanaian lives, assuring of government commitment to address the issue. The First Lady made the remarks at the commissioning of a newly constructed maternity and children's ward in Istikoko in the Oti region, describing the project as a decisive step towards strengthening healthcare delivery in underserved communities.
For years, residents of the newly created region have been in a difficult state accessing quality healthcare. Lives have been lost, according to chiefs in the area, as a result of fracture. For the First Lady, this is a grave concern, prompting the need for a new health facility, while disclosing that the facility has been furnished with essential medical equipment, including infant incubators, ultrasound machines, operating tables, infusion machines, patient monitors and oxygen support systems. She raised issues with the no-bed syndrome in healthcare facilities nationwide, pledging government response to the crisis.
We have had heartbreaking stories of life lost due to a lack of hospital beds, poor maintenance, and systems that failed when they were needed most. We cannot allow that to happen here. This facility is the 4th modern health facility completed by the Lordina Foundation. We have also renovated and expanded the Hohoi Adabaka Clinic. Each facility reflects our belief that no woman should die while giving birth, and that no child should begin life without proper care.
Health Minister Kwabna Minta Kando says the commissioning of the new facility is in line with the promise of the free primary healthcare system.
This commissioning aligns with the Ministry of Health's quality-focused free primary healthcare initiatives, which seeks to remove financial barriers and make essential services consistently available at the first point of care. It also reflects the collaborative approach we require, including well-structured public-private partnership that support infrastructure, equipment, maintenance, and service innovation while safeguarding quality and accountability.
Meanwhile, he has assured the deployment of practitioners to the area to aid healthcare delivery.
Government is therefore focused on ensuring that every district has the very least 2 doctors to attend patients alongside the midwives, nurses, and community health staff who sustain care at the front line. Commissioning is just the beginning. Sustained services will require staffing, essential equipment, medicines, supplies, strong infection prevention, effective supervision, and a traditional authorities, and a culture of maintenance.
To another health concern, and cardiologists and public health experts are warning of a growing heart failure crisis in Ghana, a condition they say is increasingly affecting people in their most productive years. The concerns were raised at the 8th Annual General and Scientific Meeting of the Ghanaian Society of Cardiology.
Heart failure is emerging as one of Ghana's most pressing health challenges. At the Annual General and Scientific Meeting of the Ghanaian Society of Cardiology, specialists revealed that cardiovascular diseases have steadily increased over the past decade, with heart failure now the leading cause of cardiac admissions.
I always liken the heart to a house where you have the wall, the electricity, and the pipe. So if the pipe flow or blood flow through the pipe is blocked, you develop a heart attack. The things that drive this, once again, is hypertension, cholesterol, and diabetes that's not properly controlled.
In specialized centers such as Komfanochi Teaching Hospital, heart failure accounts for nearly 88% of cardiac admissions.
Unlike in the Western world, where heart failure is often a disease of the elderly, our patients are young. The average age of a heart failure patient in Ghana is in their 50s, nearly a decade younger than their Western counterparts. We are losing our workforce, the very backbone of our economy and families, to a condition that is often the final common pathway for uncontrolled hypertension.
Ghana currently has fewer than 50 cardiologists serving a population of over 30 million, roughly one specialist for every 1 million people. The Chief Executive Officer of the University of Ghana Medical Center, Dr. Abdul Samad Tanko, announced that 3 new catheterization laboratories are being established with support from the Ghana Medical Trust Fund.
Hitherto is only in Kolebu Cardiothoracic Center and the University of Ghana Medical Center and maybe in Urake and Bank Hospital. They have these facilities. Kumasi, there is none. Now one is being built as we speak. Tamale is going to get one. And the 3rd cath lab is going to be at the National Cardiothoracic Center. Kolebu has one, which is not a very big one. As we speak, the renovations are being done to take out, to decommission the bent one or to take it out completely and get a new one installed so that people who get heart attacks can easily access these facilities.
Health leaders are now calling for stronger hypertension prevention at the primary care level, standardized treatment protocols, improved access to medicines, and greater focus on underserved communities. The Ghana Health Service has pledged to collaborate with the Ghanaian Society of Cardiology and teaching hospitals to strengthen systems and improve long-term heart care.
Let's stay on health. The Ghana Health Service in the Amansia West District has reported improvement in maternal health care delivery despite rising cases of non-communicable diseases and HIV infections. Health authorities remain optimistic that sustained community engagement and stronger stakeholder collaboration will help improve overall health indicators in the years ahead.
The Amansia West District Health Directorate reports a concerning rise in non-communicable diseases across the district. Diabetes accounted for 3.8% of all outpatient department cases last year, while hypertension made up 5.6%, both figures higher than those recorded in the previous year.
Through community engagement, through public education, on lifestyle modification, we are going to be